Let me just start by saying I'm Claire Ramsey. I'm with Justice and Aging. I was one of the members of the Long-Term Services and Supports subcommittee on the master plan and have been quite involved with master plan implementation, and Justice and Aging has been doing quite a bit of work on that. So I'm sort of like, when Debbie said there was two of us, I'm the one who's sort of on the MPA side, and then I'll turn it over to Mariana so she can introduce herself.
Thank you, Claire. Hi, everyone. I was having technical difficulties finding the space, but I'm so happy to be here with all of you and to see there's such interest. I'm going to say some introductory remarks and get us as quickly as possible into the work. First, let me share who I am, for those of you who don't know me. I'm Mariana Moore, the Senior Director for the Ensuring Opportunity Campaign to End Poverty in Contra Costa, generally known as Ensuring Opportunity. The mission of our work is to end poverty in Contra Costa by ending racism, structural inequities, and harmful policies and practices. And I and we have done a lot of work around aging, particularly in the area of housing. We're part of the Advisory Council on Aging Housing Work Group. And I have two elders who have lived with me during the pandemic. My mother recently passed away, and I was honored to support her through her journey with dementia. So this also really matters to me personally, as I know it does to many of you. So very glad to be here with you today. What I want to do now is just kind of briefly scope out what we're doing. And then you're welcome to, in the chat, ask questions and put your ideas throughout, as we've been saying in the main session. So for the next, I think still 20 to 25 minutes, our goal as this group is to identify 3 areas of focus for the next year in the realm of affordable aging. And if you've looked at the master plan, it has to do with ending homelessness, income security, protection from poverty and hunger. So it's a really broad, important, rich area that we're going to get into discussion about. And one of the guidelines that's really important to say is don't go to thinking about the barriers like funding or policies. Think instead aspirationally. So as we work together to build a Contra Costa where everyone belongs and has what they need, what do we need to focus on to get there? Our highest, biggest, boldest thinking is what we invite you to do. And we know there's going to be more than 3 initiatives or focus areas to get there, but this is a 10-year plan, as has been said, and we're going to build on the work throughout the years. And so today we're talking about where we start. We recognize that not all ideas or topics can be delved into deeply. So we ask that you please write your comments in the chat, and we are going to sift through and organize all of the ideas. They will be captured, they will be documented, they'll be part of our collective work. In terms of just the technology, if you go to the reactions button at the bottom of your screen, you can raise your hand and Claire or I will be happy to facilitate the conversation. We're not going to be super stuffy or formal, but we do want to use our time well. I would ask also that if you don't want to speak out loud, again, use the chat. If you do speak out loud, please just monitor the amount of time you're taking. It's a relatively short period of time, and we do need to get to those 3 beginning focus areas that Claire and I are tasked with reporting out to the full group when we're done. Claire, is there anything you want to add either about this issue area or anything else before we open it up?
No, I think that all sounds great. I just want to mention we are having a little issue before Maria came in the room and was able to assign the captioner, and I'm not clear how to do that. I'm looking and I'm not seeing it. So I don't know, Amanda, if you know how to do that. It just doesn't look like I have the option to. So that I just wanted to flag that. And then the other thing, it would be great, because I know it would probably take too much time for everybody to introduce themselves. If everyone could put their name and organization in the chat, that would be great, because then that also people will know each other, and then it also preserves it for everyone. And so I think we can get going.
All right, so we're just going to open it up to, we have 12 folks in this group. That's a nice number. We'd love to hear all your voices, verbally and or in chat. So as we think about affordable aging and your own perspective and your own ideas, we'd love to have someone jump in with just to kind of get us started and share your idea.
And I also want to just say, I'm sorry to break the ice a little too, is, you know, I don't know how many people have had a chance to look at the actual master plan, but this section of the master plan, the biggest goal is we will have economic security for as long as we live. That's sort of the overarching bold goal. At the state level, the target is to close the equity gap in and increase elder economic security. And then there's 3 strategies, which are ending homelessness for older adults, income security as we age, and protection from poverty and hunger. So if that helps, like, give any of you thoughts about, like, what would any of those pieces look like specifically in Contra Costa? Hopefully that can also help spur discussion, since obviously income security and ending poverty and affording aging are large topics.
So right off the bat, I thought of the California supplement to SSI. You know, I know that there is a supplement called SSP, and you know, I don't know when the last time that was raised. I know that they do an incremental cost of living, I think of like 2% a year. So I would think that that would be a place to, you know, you'd have a target already of a ton of people who are below the poverty line that receive SSI, SSP. So if that could be looked at, you know, the state level, you'd be able to capture some people. I think they recently allowed people on SSI to finally apply for CalFresh. And so I think maybe looking at the regulations around making more people eligible to CalFresh based on age, not necessarily just income eligibility, but age eligibility. So those are the 2 things that just jumped out to me.
I would agree with what Anthony said. I mean, I think SSI was cut during the recession and has never really been, or not during the recession. Yeah, during the recession under Schwarzenegger, but never really was fully restored. And then the cost of living increases never really were fully restored either. So that needs to change. And then agreed with CalFresh benefits, they're just not adequate. You know, most seniors get the very minimum, which is about $16 a month, and it's just not enough. So I think reducing barriers and making more benefit adequacy would be good on that front.
Hi, I'm Anna. I'm going to pivot a bit and talk about homelessness and ending homelessness and preventing homelessness for older adults. There's a great opportunity for the Home Key to really support people who are very low income, who were homeless to begin with. And we know that the project Room Key prioritized people who are older adults, but are those housing that they're getting turned into Home Key, which is supposed to be permanent, conducive to aging in place? And I would argue that because there are, you know, motels, that they probably are not. So we have an opportunity right now to really get into providing some guidance as service providers who know about aging, to make sure that these rooms, these housing, become a permanent solution so that they can continue to stay in these homes for as long as they can and not end up back into homelessness as they decline and the housing is no longer suitable for them to live in.
Anna, can I ask a clarifying question as I'm taking notes to share with the organizers? Did you say that the hotels and the Home Key setting is conducive to aging in place or is not?
Not, because they're set up as motels.
Uh-huh.
You know, these are motels that got bought,
Right.
you know, through the project Room Key. And a lot of the seniors that got placed in these Room Key as part of the pandemic response are now staying in these motel rooms through Home Key as part of the permanent solution, right? But they're not, you know, we need to make sure that that these rooms, these new housing that are not getting offered to people who are formerly homeless become a permanent housing for them.
I just wanted to add a different perspective. From my perspective, one of the problems, and it's not just to Contra Costa County, but that's what we're addressing, is the fact that you can enter aging and be financially sound, but there's many things that work against the population and seniors. Specifically, I'm going to speak to lack of transparency in the cost of different services that seniors use. There's no oversight. There's no way to look at, maybe you're going to move to independent or assisted living. You can't do any cost comparison. And so I see a lot of people, maybe they've had careers like all of us have had, and everything's fine until you need a service, and there's no way to do some cost comparison, and there's no oversight of that. So we have a population that in a lot of ways is doing great, and then suddenly it's like they're forced into poverty. And I'd like to see that addressed.
I'd like to piggyback on what Melanie said, in that I think we see a plethora of services for the wealthy, seniors who are wealthy, and also obviously not a plethora, but services for people who are in that poverty level. But there is a giant canyon of people who, when they need care, they spend their life savings on caregiving and then are in poverty. Like if you think about someone caring for someone with dementia, there's nothing left for the caregiver when they need services. So how do we open up eligibility to services we do create for people in the middle?
The other thing to tag on it, I believe when you're looking about finances and it should be something where we're educating our entire lives. Even educating young people as young as high school on the issues that they're financially. It can't just be this group that's looking at all these different services and questions on aging. We really need to start it young so they're prepared. And the mindset changes, because this is so much on the affordable or affording aging, but this very common concept in society that people will kill themselves before they go to a facility, that's something we need to break. And I hope it happens in my lifetime.
Hey, you guys could hear me typing. I'm sorry. I just realized I wasn't muted and I was typing. I'm sorry. I hate that. But I was going to ask Claire from Justice and Aging, who really worked on this area and long-term services and support in the master plan. And really it's Justice and Aging. Like if Justice and Aging had a local baby, it would be Mariana Moore's Ensuring Opportunity, although her group is a little bit larger than just the aging population. But what are local interventions that you think would move the needle on being able to afford aging in Contra Costa in the context of this small thing like Justice and Aging? We're looking at Social Security increase in revenues and payments, and we're looking at federal fixes and state fixes. What are some local fixes that you might think we could discuss and talk about?
Yeah, no, I mean, I think some of the pieces that people have started to bring up, I think, lend themselves to local fixes, even though some of them also involve state work. So for example, talking about CalFresh and making sure people have as much access as possible. There is obviously, at the state level, like what can we do to make it more accessible? There's bills right now to make it less cumbersome to apply, but also we have the lowest uptake rate. California has the lowest uptake rate of of food stamp benefits in the country. So it's like, how do we locally improve rates of CalFresh uptake? There might be a lot of seniors who would qualify, but don't realize it. I also think there's power in figuring out if there's a collective problem happening, how do you elevate that? So saying the point about only getting $16, right? It's a lot of work for $16 a month. You might see that we're routinely seeing the same problem, which is seniors are very low income, but they don't have enough deductions to really get it. So also the collective power of maybe there's a fix on that. That might be state level, but that can really help because you guys are gathering stories. In terms of what was pointed out about Project Room Key, I think working locally to really talk about accessibility in the units is a huge piece. In LA, they were actually not prioritizing older adults, and we're doing the exact opposite. We're keeping people out because they were ooh, that's a lot of work and we're not sure it's accessible. And so So what is Contra Costa actually doing? Who's actually getting housed and staying housed? And then is there work to be done there? We haven't had a chance to read, Elaine had put in the chat, create a comprehensive list of nutrition options for seniors, bring those folks together to discuss how to work together, discuss gaps, and then ADRC creation. ADRCs are, what is it? Aging and Disability Resource Connections in East, Central, and West County. So I think that's another good point about like capturing local resources and making it much clearer for people. Because you guys all might know this stuff, or you might know a piece of it, but it's amazing. You get a little further out, like on the rings of what people know, and people don't know much, right? Like they may only have one number, or like not have figured out how things all connect together. So that kind of resource generation, I think, is huge. And then, you know, the financially, I mean, it's the sort of problem of like what is available to sort of the middle class, I think, is, you know, is not unique to Contra Costa. I think Contra Costa has some pretty big, you know, you have some swaths where people feel pretty comfortable, some swaths where people feel pretty marginalized by like what services are available. I do think if you could do some local mapping of what's available in different areas into different groups, that could be extremely helpful. Because sometimes people talk about the problem, but it's really unclear like where and who, and it might seem like everybody knows, but I don't think everybody knows. So that could also be like really helpful, sort of mapping out like where are services actually available, to what populations are those services available, where are the gaps there. So those are some of my initial thoughts, and I want to make sure other people have a chance to talk to.
What if there was like a county or state run long-term care insurance tax or something that followed people, similar to what Newsom set up in San Francisco when he created a universal health care in the city of San Francisco when he was mayor? That could be, I mean, that is big and a long-term plan, but that could be something that followed people from, you know, early adulthood to age to seniorhood.
I just wanted to say that also some of your big ideas, you guys, are being worked on. So the legislature did include a fairly substantial increase to the SSP, which is the SSI, state supplement of the SSI, in the budget. Now the question is, will Newsom agree to it, and will it actually get funded? But Newsom's budget included a cost of living increase, which, as somebody mentioned, had been like very, like basically delayed. I think that was Caitlin, right, has said that. So that's one thing. Another piece is that big idea about a long-term care benefit. There is work being done on that. There is a long-term care insurance task force at the state level. There's also a group called CADA, California Aging and Disability Alliance, that's working on that. But that's a lift, right? That is a no joke lift. One other thing that we've been working on is, I agree that there are always going to be people sort of in that middle section, but one other thing to think about is, how do we make Medi-Cal less or more accessible to people? How do we bring it up? One way we're working on that this year is advocating for the elimination of the asset test in Medi-Cal. That was also included in the legislative budget. We're waiting to see if it gets into the compromise as the final budget, but that would be an example of, you might have somebody low income who has 10,000 in assets. They're not Medi-Cal eligible right now, but with no asset test, they would be. So trying to figure out, what do we already have that we can expand? How do we create something new, which is a long-term project? Washington State and Hawaii have both done that. So it is possible. It's just an enormous lift. And you really have to get a lot of buy-in, because it would be probably some kind of tax to pay for it. It wouldn't just like, you know, and then there's like talk at the federal level. I just saw Elaine's comment about vision and dental. So vision and dental do exist in Medi-Cal. In Medicare, there's now work being done to see if it can be added into Medicare. So it's a very dynamic environment right now. And you guys having so much of a grasp of like what's happening state and federally and then locally is really powerful, right? Like you guys are all talking about solutions that like work at 3 levels. So, you know, also thinking about, to Jody's point, right, it's a multi-year effort. So what do you feel like would be most impactful for your seniors over the next year? And some of this stuff might happen in the next year, like the SSI increase. Some of it might be building up to more work, but what are people feeling like? Oh yeah, Mariana, sorry.
No, that's okay. I didn't want to cut you off. I just want to notice there are about 6 minutes till go time. And in that 6 minutes, we need to sort of narrow down or clump into 3 ideas. And I was sort of taking notes as we went and trying to synthesize. So let me attempt, I'm sure imperfectly, I have sort of 4 buckets, and I'm sure I missed something, so please add. One is nutrition. So we talked about increasing the CalFresh, both enrollment and benefit, and doing some state advocacy around SSP, sort of that sort of benefits and nutrition piece. The second bucket that I wrote down was housing. We talked about Project Room Key and sort of the aging in place and making it more conducive. The third one was around what I just wrote down as a missing middle, meaning middle income, sort of mapping what's available, being more transparent, supporting cost comparison, savvy consumers. A fourth one wasn't stated by the group, but I kind of wrote down communications. The idea around, and there's a better term for it, but sort of educating folks and starting young and what's available and how to navigate at maybe all income levels. So those are the 4, and I'm sure I missed stuff, but I'm just like, as we try to kind of take the last few minutes to do that difficult task of, and again, all the ideas are captured both from our notes and from the chat, so never fear. But we are charged with picking 3 chunks of things that will be a focus for this issue area for the first year of this 10-year plan. So any thoughts on kind of where we might land with that over the next 5 minutes so we can report back?
Claire, you asked about short-term goals. Is there any way to increase the amount and the coverage of the Contra Costa County cafes, the CCC cafes? Because I know those create free or low-cost food and a really fabulous opportunity for socialization.
Those are, they're pretty much in every community. So I think increasing participation in those would be a great goal, and one that we would share. I think that would be a great goal, to increase participation in the congregate feeding sites.
Okay.
Cafes are better than congregate feeding, but yeah.
Great. And I was just gonna say, that might be another place to talk to people about CalFresh, for example, too. Like you could do
100%.
CalFresh, yeah.
Mm-hmm.
Sorry, Anna?
Just a quick thought, something kind of simple, just coming out of the heels of Dr. Aronson's comments on ageism. I think maybe some kind of a campaign, really just to incentivize or really encourage employers to hire older adults, because I think a lot of older adults are facing discrimination when it comes to job seeking, and a lot of them do want to work and continue to work, even if it's just a part-time. It gives them a sense of purpose and also some kind of an income stream, but they do face that discrimination. So some kind of a campaign to incentivize employers to hire older adults, and maybe down the line, from a policy perspective, some kind of an incentive for, tax incentive for employers as well to get something out of hiring older workers.
All right, brilliant idea. We're still expanding ideas. I'm gonna just be really mean and make you narrow ideas, knowing that there'll be lots more actual conversations, but this is my job, I gotta do it. So would anyone like to propose? What I've heard the most discussion of is nutrition. So I think there could be maybe a bucket around nutrition and adding the CC cafes and educating folks on CalFresh there. And then housing was another idea. And then sort of more transparency, mapping and communication around services that are available. And then the sort of employment. So now I have kind of 4 new buckets. Does anyone want to make proposals, or how do we get to 3 in the next 2 minutes? I'm just asking for folks' help.
Well, since the title of this group is Affording Aging,
Mm-hmm.
and I think one is of course, if you can get discounted meals,
Mm-hmm.
That's a way to afford it. If there is some good housing options available, which I know that is one of the number 1 issue
Mm-hmm.
affecting the older population. Number 2 is nutrition.
Mm-hmm.
So that would be, and then the other one was this. I hear about it a lot. I used to work for IHSS, and it's this middle that are not poor enough to get in-home care paid for, and not wealthy enough to pay for someone. And so, how do we bridge that gap?
Mm-hmm.
And is that bridge that gap by offering some sort of incentives or supplement like they do with childcare?
So maybe Mariana, for the nutrition one, it's just about increasing participation in all nutrition programs, from congregate feeding to home delivered meals to How Fresh to
yeah.
food, to all
got
the
it.
subsidized nutrition programs that are out
Brilliant. I love it. That's great. All right, so we have increasing access and participation in all nutrition programs and affordable meals. For housing, do we want to focus on the Project Room Key, not conversion, but sort of increased access? Or is there a broader housing? And again, we're running low on time. And then the third one is something around middle income and sort of the in-home care affordability gap. I'm just kind of cutting to the chase. Does that make sense for folks?
Yeah.
Penny, did you have your hand up, or is that okay? Okay. All right. I'm going to type.
Mariana is collecting all this, and I'll be reporting it out at
Yes.
the main session. And I just want to say, though, you guys, these are actually really good ideas that you can do. So
Yes.
I just hope that, I know Debbie will not let you not do them. So I think, really moving forward on these are things you could do over the next year. So I really appreciate you guys putting all this thought and effort into it.